Okay, so like everyone's been talking about this HMPV thing, right? And especially what's happening in China. It's kind of freaking people out. So we're going to do a deep dive on it today. Look at some articles from The Standard and Mint and Newsweek, and even one from NDTV over in India. Try to get the whole picture. So basically figure out like what even this HMPV thing, and how worried should we be? Is it going to be like the whole COVID thing all over again?
Yeah, it's pretty crazy how fast this has blown up. I mean, it kind of shows you how on edge everyone still is after, after COVID. Like everyone's kind of primed to freak out about the next pandemic.
For sure.
Oh.
Okay. So HMPV. I've heard of RSV, but this is like a new one for me.
Yeah. So it stands for human metapneumovirus. And you're right, most people haven't heard of it. It's not like as famous as RSV or anything. But here's the thing, it's not actually new. Scientists officially discovered it back in 2001, but they think it's actually been around for way longer. Maybe even since the 1950s. We just didn't have the test to identify it back then.
Wow, so it's been hiding in plain sight all this time. So, okay, what happens if you get it? Is it like a cold or the flu?
Yeah, pretty much. It's usually fever, cough, runny nose, maybe some wheezing. But for some people, like little kids or older folks or people with weaker immune systems, it can get more serious. Could turn into bronchitis or even pneumonia.
Yikes. Okay, so how does it spread? Is it like COVID where you just breathe the same air and you're doomed?
It's mostly through close contact and respiratory droplets. So kind of like how COVID spread, in the beginning. So all that stuff we learned during COVID, like washing your hands and covering your coughs, that still applies.
Right. Okay. So speaking of COVID, this whole thing in China is giving everyone major flashbacks. The Standard is saying hospitals are totally overwhelmed. People are wearing masks again. It's kind of scary seeing those images again,
Yeah, for sure. There's definitely some scary stuff out there, especially on social media, like videos of people lined up outside hospitals and stuff. But we don't really know the whole story yet. China's not really saying how bad it is. Or if it's more than normal for this time of year,
Yeah, it's like deja vu with the whole COVID thing. Remember how hard it was to get info out of China back then? Newsweek was even saying that the WHO was telling China to be more transparent with their data, just like they did back then.
Right. It's super important to have good data. During COVID, that's how researchers tracked the virus and figured out how it was changing and stuff. And that helped them figure out how to fight it. We need that same level of transparency now.
Totally. So, okay, we've got this virus that acts like a super cold or flu.
Yeah.
And it spreads really easily. And it's maybe overwhelming hospitals. How does it stack up to COVID exactly, besides the obvious stuff?
Well, they're both what they call respiratory viruses. They have similar symptoms, they spread the same way, and they both hit the same people the hardest, like little kids, old people, people with compromised immune systems.
Right. And Mint was saying that they both seem to peak during certain seasons. So maybe that's part of what's going on in China now. It's just the time of year,
Yeah, that could definitely be playing a role. But there is one big difference between HMPV and COVID that we should talk about.
You mean the vaccine thing? We got lucky with COVID and eventually got a vaccine, but for HMPV, we don't have that yet.
Exactly. And to make things even trickier, there aren't any specific antiviral treatments for HMPV either. So basically all we can do is treat the symptoms and hope for the best.
Oh, man. So it's back to basics, like washing our hands and hoping we don't get sick. I can see why people are freaking out. But should we be panicking? What are the experts saying?
Well, everyone's watching it closely. The WHO is working with all the different health organizations around the world, trying to get a handle on it. I don't think it's time to panic yet. But we should definitely take it seriously and do what we can to protect ourselves.
So we don't need to go stock up on toilet paper?
Probably not. But it's a good idea to be prepared. Wash your hands, stay home if you're sick, that kind of thing. It's about finding that balance between being aware and not totally freaking out.
Right. NDTV had a quote from Dr. Atul Gul. He's the top health official in India. And he was saying pretty much the same thing. Take precautions, but don't panic.
Yeah, that makes sense. We know those basic hygiene things work, and they're even more important now since we don't have a vaccine or anything.
Okay, so we're not in full pandemic mode yet, but it's definitely on our radar. So what should we be watching for as this thing develops? What are the next steps?
Well, we need to see how it plays out, both in China and around the world. They'll probably start doing more testing for HMPV. That'll give us a better idea of how many people have it and how fast it's spreading. And of course, researchers are going to be working hard to find a vaccine and treatments.
Right. Speaking of research, Newsweek brought up something interesting about herd immunity. Since HMPV has been around for a while, even though we didn't know what it was, could that mean some people are already immune?
That's a really good question, and it's something researchers are looking into. The idea is that if you've been exposed to HMPV before, even if you didn't get sick or only had mild symptoms, your body might have built up some immunity, and that could help slow down the spread.
Like with chickenpox. Most adults had it as kids, so they're immune now.
Yeah, kind of. But with HMPV, it's a respiratory virus, so it might work differently. Researchers are still trying to figure out how long that immunity lasts and how strong it is.
So it's not like a foolproof shield.
Yeah.
But it could be helping? This is starting to feel like a detective story.
Yeah.
Trying to piece together all these clues about HMPV and figure out what's going to happen next.
Yeah, it is. And the more information we get, the more important it is to be careful about what we believe, especially with all the stuff flying around on social media. It's easy to get caught up in misinformation.
For sure. Okay, so we're learning about HMPV. We're watching China. We're trying to figure out how worried we should be. But let's get practical for a sec. What can we actually DO about all this?
That's a great question. And it's one we're going to dig into after a quick break, so stay with us.
Okay, so we were talking about like what we can actually DO, to protect ourselves from this HMPV thing.
Right.
It's good to know about it and all. But we need to like actually do something right.
Totally. And the good news is we've kind of been here before. A lot of the stuff we learned during COVID still applies to HMPV.
Right. So it's not like we're starting from scratch.
Exactly. It's like we have this playbook now, we know it works.
Okay. So what's in the playbook?
Well, the first thing is always the first thing. Wash your hands with soap and water for 20 seconds at least.
Yeah. The good old 20 seconds.
It's basic, but it really works.
And if you can't wash your hands, like if you're out and about, hand sanitizer, right?
Yep, exactly. At least 60% alcohol.
I always keep some in my bag now.
Good idea.
What about masks? I know people are kind of over them, but they worked for COVID, right?
Yeah, they definitely helped, especially in crowded places or places with bad ventilation.
I've noticed more people wearing them again lately, like on the subway and stuff.
Yeah, it's we're all kind of remembering what worked before.
And even if there aren't official rules about masks anymore, it's still a good idea to wear one if you feel like you need to,
Right, it's about personal responsibility.
And protecting other people, too.
Exactly.
What about social distancing? I mean, it was kind of a pain sometimes.
Yeah, it was.
But it did help slow down COVID.
It did. We don't need to be as strict about it now, but it's still a good idea to be careful, especially if you're not feeling well.
Right, maybe skip that crowded concert if you're feeling sniffly.
Exactly.
And speaking of not feeling well...
Stay home. If you're sick, stay home.
Yeah, I know. That's hard sometimes. You feel like you have to go to work or school.
I know. But it's so important. You don't want to get everyone else sick.
It's like a cultural thing, right? We need to stop thinking of staying home when you're sick as weak or something.
Exactly. It's actually really responsible.
It's about protecting everyone.
Right.
Okay, so we've got the COVID playbook. Is there anything else we can do to get ready for this HMPV thing?
Well, the biggest thing is to stay informed. But make sure you're getting your information from good sources.
Right, not just random stuff on social media.
Exactly. Stick to the WHO, the CDC, reputable news outlets, your doctor.
It can be hard to know what to believe sometimes.
Yeah, it can. Just be wary of anything that sounds too good to be true or too scary to be real.
Right. And what about vaccines? I mean, that was the big game changer with COVID.
Yeah.
But we don't have one for HMPV yet.
Not yet. But they're working on it. In the meantime, make sure you're up to date on your other vaccines, like the flu shot.
Yeah, that's a good point. It's not going to protect you from HMPV.
Yeah.
But it'll help with other stuff.
Exactly.
And it'll keep you from getting even sicker if you do get HMPV.
Right.
So basically, take care of yourself.
Yep. Eat healthy, get enough sleep, all that good stuff.
And what about can we do anything to push for a vaccine? Or better treatments?
Definitely. You can contact your representatives, tell them you support funding for HMPV research.
Right. And there are organizations that are working on it too. You can donate to them or volunteer. Every little bit helps.
Absolutely.
Okay, so the situation in China is scary.
Right.
But it's not time to panic.
Right.
We have the tools to protect ourselves.
Right.
And we can make a difference by supporting research and stuff.
Right.
But it's not just about individual actions, right?
So right.
We need to work together on this, globally.
Absolutely.
This virus doesn't care about borders.
It doesn't.
So what does that look like? Working together? I mean...
Well, for one thing, we need to make sure everyone has access to good health care. Remember how overwhelmed hospitals were during COVID? We need to make sure that doesn't happen again.
Right. We need to invest in healthcare systems all over the world.
Exactly.
And what about like sharing information? We were talking about that before.
Yeah, that's super important too. Countries need to be open about what's happening so we can track the virus and respond quickly.
Well, especially since this thing can travel so easily.
Right.
So the WHO is like the key player here, right?
Yeah, they're like the coordinators. They're working with all the different countries to make sure everyone's on the same page.
So we should support them.
Definitely.
What about governments? What should they be doing?
Well, they need to have good systems in place to detect outbreaks early.
Like testing and contact tracing and stuff?
Right. And they need to communicate clearly with the public so everyone knows what's going on and what to do.
Right. And they need to make sure everyone has access to healthcare.
Exactly.
And what about research?
Governments need to invest in research too, both for vaccines and treatments, and for just like basic research on the virus.
Right. The more we know about it, the better we can fight it.
Exactly.
And this research should be like a global effort.
It should.
Everyone working together, sharing data and findings.
That's the best way to make progress.
Okay, what about like the companies that are actually making the vaccines and treatments?
Yeah, they have a big role to play too.
But we need to make sure those vaccines and treatments are available to everyone.
Exactly, not just people in rich countries.
Right. It needs to be fair.
It does.
Okay, so we've got individuals, we've got governments, we've got companies. What about the media? What's their role in all this?
Well, they're the ones telling the story, right? So they need to be careful to report the facts accurately and avoid sensationalizing things.
Right, because that just freaks people out.
It does. And it can make people lose trust in the experts.
Right. So basically, we need the media to be responsible.
We do.
Okay, so it's complicated. There are a lot of moving parts here.
There are.
But the main takeaway is we need to work together on this. It's a global problem.
It is.
And it requires a global solution.
Exactly.
And we need to learn from what happened with COVID.
Right.
We can't just go back to business as usual. We need to be prepared. And we need to support each other. Because this could happen again.
It could.
With HMPV or some other virus we haven't even heard of yet.
That's the reality we live in now.
So this whole HMPV thing, it's scary.
It is.
But it's also a wake-up call.
I think so.
We need to take this seriously. And we need to work together to solve it.
Absolutely.
Okay, well, that's a lot to think about. Let's take a break and then we'll come back and talk about some of the key takeaways from all this. All right, so let's kind of like sum up what we talked about with HMPV. We went over like what it is, how it spreads, that whole thing in China, and how it compares to COVID.
Yeah, we talked about all those things we can do to like protect ourselves, you know, like washing our hands and wearing masks if we need to.
Right.
And staying home when we're sick.
Right. All that basic stuff we learned during COVID.
It's still important.
But it's not just about us as individuals, though.
Right. Definitely.
We need to work together on this.
We do.
Like as a global community.
Exactly.
It's like this virus doesn't care about borders or anything.
It doesn't.
So we need to be on the same page about how to deal with it.
Right. And we need to support each other.
And make sure everyone has access to good healthcare and information.
Absolutely.
So I guess the main takeaway from all this is we need to be prepared.
Yeah.
We need to be aware of what's happening.
Yeah.
And we need to take action to protect ourselves and our communities.
And not just our own communities, the whole world.
The whole world. Yeah.
This is a global issue.
It is. But the good news is we're not starting from zero here.
Right.
We learned a lot from COVID.
We did.
Like how important those basic public health measures are.
And how important it is to work together.
Exactly. And how to develop vaccines and treatments quickly.
Right. That was a huge accomplishment.
It was. And we also learned how to like adapt and be more resilient. Like we figured out how to work remotely, how to stay connected with people even when we couldn't be together physically. We found ways to cope.
We did.
So maybe all that stuff we went through with COVID actually made us stronger.
I think it did.
Like we kind of had a crash course in pandemic preparedness.
Yeah, it's like we're better equipped to deal with this kind of thing now.
Right. So I'm not saying it's going to be easy.
No.
This HMPV thing could still be really bad.
It could.
But I do think we're in a better position to handle it than we were a few years ago.
I agree.
Okay, so I think that about covers it. We learned about HMPV. We talked about the situation in China. We compared it to COVID. We talked about what we can do to protect ourselves.
And what we can do as a global community.
Right. So hopefully you're feeling a little bit more informed and a little bit more empowered.
That's the goal.
To understand the world around us and to know what we can do to make things better.
That's what the deep dive is all about.
It is. All right. Well, thanks for joining us for this deep dive into HMPV. Until next time, stay curious and stay well.